The dentist said it was just sensitivity. Then the infection spread to my brain. The pain started on a Wednesday morning in late September while I was eating cereal before my shift at the hospital. A sharp electric jolt shot through my upper right molar when the cold milk hit it, making me gasp and drop my spoon. I pressed my hand to my cheek and waited for the pain to fade, which it did after about 30 seconds, leaving behind a dull ache that pulsed with my heartbeat. I rinsed my mouth with warm water and told myself it was nothing serious. I was a 28-year-old surgical nurse at County General. Healthy. No dental problems in years. Probably just a cavity that needed filling. I'd been too busy with double shifts to keep up with my regular cleanings. I made a mental note to call Dr. Whitmore's office during my lunch break and went to work. The pain came back during my shift, sharp and sudden when I drank ice water from the staff lounge. One of my colleagues, an older nurse named Beverly, noticed me wincing. "You okay, Jordan? You look like you're in pain." I nodded, pressing my tongue against the tooth experimentally. "Just a sensitive tooth. I need to get to the dentist." Beverly frowned. "Don't put it off. My sister ignored tooth pain for months and ended up needing a root canal." I called Dr. Whitmore's office that afternoon and got an appointment for Thursday morning. The receptionist squeezed me in at 8 a.m. before their regular schedule started, which I appreciated. Dr. Richard Whitmore had been my dentist for 5 years, ever since I'd moved to the city for my nursing job. He was in his 60s, confident bordering on arrogant, with a practice that catered to professionals who valued efficiency over bedside manner. His office was always immaculate, his staff always rushed, his appointments always running exactly on time. I'd never had a problem with him before. He'd filled 2 cavities over the years, done my cleanings, never given me reason to doubt his competence. When I arrived Thursday morning, the receptionist barely looked up as she handed me the standard paperwork. The hygienist, a young woman I didn't recognize, took me back immediately and did a quick x-ray of the painful tooth. Then Dr. Whitmore came in, glanced at the x-ray on his computer screen for maybe 10 seconds, and turned to me with a dismissive smile. "Everything looks fine structurally," he said, his tone suggesting I was wasting his time. "No decay, no cracks, no abscess. You're experiencing thermal sensitivity, probably from recession of the gum line, very common in adults your age, especially with aggressive brushing." He barely looked at my mouth. I opened my mouth to protest, to tell him the pain was more than just sensitivity, that it was getting worse, that something felt wrong. But Dr. Whitmore was already turning away, typing notes into his computer. "I'm prescribing a sensitivity toothpaste. Use it twice daily for 2 weeks. Avoid very cold or hot foods. If the sensitivity persists beyond a month, we can discuss other options. But in 90% of cases, it resolves on its own." He stood up, signaling the appointment was over. I'd been in his chair for less than 8 minutes total, including the x-ray. "But Dr. Whitmore, the pain is pretty intense. It's not just sensitivity, it really hurts when I—" He cut me off with a patronizing smile. "Jordan, I've been practicing dentistry for 35 years. I know sensitivity when I see it. The x-ray is clear. There's no infection, no structural damage. You're fine. Use the toothpaste. Give it time." His tone made it clear he wasn't interested in further discussion. I left the office feeling dismissed and frustrated, but told myself he was the professional. He'd looked at the x-ray. He'd said everything was fine. Maybe I was overreacting. Maybe it really was just sensitivity that would resolve with the special toothpaste he'd prescribed. The pain got worse over the next 3 days. The sensitivity toothpaste made no difference. By Saturday evening, the throbbing in my tooth was constant, a deep ache that pain medication barely touched. I took ibuprofen every 6 hours, the maximum dosage, and it only dulled the edge. Sunday morning, I woke up with swelling in my gum above the tooth. I could feel it with my tongue, a tender raised area that made my entire jaw ache. My face looked slightly puffy on that side when I examined it in the bathroom mirror. This wasn't sensitivity. This was an infection. I called Dr. Whitmore's emergency line and got his answering service. The operator took my information and said a dentist would call me back within 2 hours. 3 hours later, a different dentist from the practice called Dr. Gary Huang, who I'd never met. I explained my symptoms: the worsening pain, the swelling, the constant ache. Dr. Huang listened and asked a few questions about whether I had a fever or difficulty swallowing. I said no to both. "It sounds like you might be developing an abscess," he said, his tone more concerned than Dr. Whitmore's had been. "But without examining you, I can't be certain. Can you come to the office first thing Monday morning? I'm on call this weekend, but Dr. Whitmore saw you Thursday and his notes say the x-ray was clear." I felt frustration rising. I know what his notes say, but something is wrong. The swelling is getting worse. "Can't you prescribe antibiotics over the phone just to be safe?" Dr. Huang hesitated. "I'm not comfortable prescribing antibiotics without an examination, especially since Dr. Whitmore just saw you and found no infection. If you're really concerned, you should go to the emergency room. They can do a CT scan if needed. But honestly, it's probably inflammation that will respond to anti-inflammatory medication. Have you been taking ibuprofen?" I confirmed I had. He told me to alternate ibuprofen and acetaminophen every 3 hours to manage the pain and inflammation, and to call the office first thing Monday morning if I wasn't better. "But Dr. Whitmore will be back Monday, and he's already familiar with your case. He'll take good care of you." I hung up feeling unheard. 2 different dentists had now dismissed my concerns. Maybe I was overreacting. Maybe this was normal dental pain that just needed time and medication to resolve. I was a nurse. I should know better than to panic over a toothache. I spent Sunday alternating pain medication and trying to rest, but the ache in my jaw was relentless. By evening, a low-grade fever had started. 99.8 degrees, barely elevated but definitely not normal for me. Monday morning, I called Dr. Whitmore's office at 8 a.m. sharp. The receptionist said they were fully booked but could fit me in at 4 p.m. if I could wait. I took the appointment, called in sick to work for the first time in 6 months, and spent the day in misery. The swelling in my gum had spread. My cheek was visibly puffy now. The pain had evolved from a constant ache to waves of stabbing agony that made me gasp. I could barely eat. When I finally got to Dr. Whitmore's office that afternoon, I was exhausted and desperate. The hygienist took one look at my face and called Dr. Whitmore in immediately. He examined my mouth, pressed on the swollen gum, and frowned. There's definitely some inflammation here. Let me take another x-ray. This time he looked at the x-ray longer, zooming in on different areas. After a minute, he turned back to me. I still don't see any obvious infection on the x-ray. No abscess, no bone loss, but you clearly have inflammation. I'm going to prescribe antibiotics as a precaution, though I suspect this is just severe sensitivity causing tissue irritation. Sometimes the gum tissue can react dramatically to thermal stimulation. He was still framing this as an overreaction on my body's part, not a genuine infection. How long until the antibiotics work? I asked, my voice rough from pain. Dr. Whitmore typed the prescription into his computer. You should start feeling better in 24 to 48 hours. If you're not significantly improved in 3 days, call me, but I expect this will clear up quickly. He handed me the prescription for amoxicillin, standard dosage, 7-day course. I filled it immediately at the pharmacy and took the first dose in my car. The relief of having antibiotics was psychological more than physical. The pain didn't change, but at least I was doing something active to fight whatever was happening. That night, I developed a headache. Not a normal headache, but a deep, pressing pain that started at the base of my skull and radiated forward. I took it as a sign the infection was fighting back before the antibiotics could take effect. I went to bed early, hoping I'd wake up feeling better. Instead, I woke up at 3 a.m. in agony. The pain in my tooth had intensified to a level I didn't think was possible. My jaw, my cheek, my temple, everything on the right side of my face throbbed with a vicious, consuming ache. The headache had worsened too, now a pounding pressure behind my right eye. I stumbled to the bathroom and took more pain medication, then stood in front of the mirror examining my face in the harsh fluorescent light. The swelling had spread significantly. My right cheek was visibly larger than my left, the skin tight and shiny. I pressed my fingers gently against my face and felt heat radiating from the swollen area. Fever and swelling spreading despite antibiotics I'd been taking for less than 24 hours. Something was very wrong. I grabbed my phone and called the dentist's emergency line again. This time Dr. Whitmore himself called back, sounding annoyed at being woken at 3:30 a.m. Jordan, you just started the antibiotics yesterday afternoon. They need time to work. Infections don't clear up in 12 hours. His voice was sharp with irritation. I tried to keep my voice steady. Dr. Whitmore, the swelling is spreading. My whole cheek is swollen now, and I have a severe headache. I think this is more serious than you thought, he sighed, the sound loud through the phone. Infections always get a little worse before they get better. That's normal. Your immune system is fighting the bacteria, which causes more inflammation temporarily. The antibiotics will work, but you need to give them time. Take your pain medication, use ice packs on your face, and try to rest. Call the office during business hours if you're still worried, but I assure you this is a normal progression. He hung up before I could argue further. I sat on my bathroom floor, pressing a cold washcloth against my face, crying from pain and frustration. Every instinct I had as a medical professional was screaming that something was wrong, but 2 dentists kept telling me I was fine, that I needed to wait, that I was overreacting. I went back to bed but couldn't sleep. The pain was too intense, the headache too vicious. By 6 a.m., I decided to go to the emergency room. I didn't care if it made me look like a hypochondriac. I worked at County General. I knew the ER doctors. They'd take me seriously, even if my dentist wouldn't. I drove myself to the hospital. Probably not the safest decision given my pain level, but I couldn't think clearly enough to call anyone for a ride. The ER was relatively quiet at 6:30 on a Monday morning. The triage nurse took my vital signs. Blood pressure elevated, temperature 101.2, heart rate 98. She asked about my pain level, and I said 8 out of 10, which was probably understating it. She got me into a room within 20 minutes. Dr. Nina Castellano, one of the ER physicians I'd worked with dozens of times, came in looking concerned. Jordan, what's going on? The nurse said you're having facial pain and swelling? I explained everything. The tooth sensitivity, Dr. Whitmore's dismissal, the worsening symptoms, the antibiotics that weren't working, the spreading swelling and severe headache. Dr. Castellano examined my face, pressing gently on the swollen areas. Her expression grew more serious as I talked. Jordan, this looks like a significant infection. I'm ordering a CT scan of your face and head immediately. Dental infections can spread to surrounding tissues quickly, and with your symptoms worsening despite antibiotics, we need to see what's happening. Relief flooded through me. Finally, someone was taking me seriously. The CT scan took 30 minutes. I lay perfectly still while the machine whirred and clicked around my head, creating detailed images of my skull and facial structures. Afterward, I was taken back to my ER room to wait for results. Dr. Castellano came back 45 minutes later with a radiologist, Dr. Timothy Oakes, both of them looking grim. Dr. Castellano sat down and pulled up the CT images on the computer in my room. Jordan, you have a severe odontogenic infection. The CT shows an abscess at the root of your upper right first molar with significant extension into the surrounding tissues. She pointed at the screen, showing me a dark area near my tooth that looked like a pocket of fluid. This is the primary abscess. But here's what's concerning. She scrolled to different images, showing cross-sections of my skull. The infection has spread beyond the tooth. There's involvement of the maxillary sinus, and we're seeing early signs of infection tracking toward the orbital cavity and the cranial vault. My medical training made the implications immediately clear, and my blood went cold. Are you saying the infection is spreading toward my eye and my brain? Dr. Oakes, the radiologist, nodded grimly. That's exactly what we're seeing. Dental infections in the upper jaw can spread through the bone and into the sinuses, and from there into the orbit or intracranial space. It's rare, but when it happens, it's a medical emergency. Dr. Castellano was already typing orders into the computer. We're admitting you immediately and starting IV antibiotics, high-dose broad-spectrum coverage. I'm calling in oral surgery and neurosurgery for consultations. The tooth needs to come out right away, and depending on how far the infection has spread, you might need surgical drainage. She looked at me with genuine concern. Jordan, I need you to understand how serious this is. Intracranial infections have a high mortality rate if not treated aggressively. You got here just in time. I felt tears running down my face, a mixture of relief that someone finally believed me and terror at how close I'd come to something catastrophic. I told Dr. Whitmore something was wrong. I told him multiple times. He kept saying it was just sensitivity, that I was overreacting. Dr. Castellano's jaw tightened. We'll deal with that later. Right now, we need to focus on treating you. Within an hour, I was admitted to the hospital where I worked, now a patient instead of a nurse. My colleagues from the surgical floor came by when they heard, shocked to see me in a hospital bed. The oral surgeon, Dr. Vincent Reyes, examined me that afternoon and scheduled immediate extraction of the infected tooth, along with surgical drainage of the abscess. We need to get that tooth out tonight, he said, his tone urgent. Every hour we wait, the infection can spread further. The surgery happened at 8 p.m. that evening. I was put under general anesthesia, which was a mercy because I was exhausted from pain and fear. When I woke up in recovery, my entire right side of my face was numb and packed with gauze. Dr. Reyes came to check on me, still in his surgical scrubs. The extraction went well, but Jordan, it was worse than the CT showed. The abscess had eroded through the bone in multiple places. We removed a significant amount of infected tissue and placed drains. You're going to be on intravenous antibiotics for at least a week, maybe longer depending on how you respond. My mouth was too numb and painful to ask questions, so I just nodded. Over the next 3 days, I was monitored constantly. The IV antibiotics were administered every 6 hours, powerful drugs that made me nauseous, but were necessary to fight the infection. My temperature fluctuated, spiking to 102.5 on the second day, which terrified everyone. The neurosurgery team came by daily to assess my neurological status, checking my vision, my reflexes, my cognitive function. They were watching for any signs that the infection had breached the blood-brain barrier. On the 4th day, my headache suddenly intensified. Not the constant ache I'd been experiencing, but a sharp, stabbing pain that made me scream. The nurse called Dr. Castellano immediately. She ordered an emergency MRI. I was rushed down to radiology, crying from pain and fear. The MRI took 45 minutes, and I had to stay perfectly still while my head felt like it was splitting apart. When the images came back, Dr. Castellano and the neurosurgeon, Dr. Alicia Fernandez, came to my room together. Their faces told me everything before they spoke. Dr. Fernandez pulled up the MRI images on the computer. Jordan, the infection has spread into your cranial cavity. You've developed bacterial meningitis and a small epidural abscess near your right temporal lobe. She pointed to areas on the screen that showed inflammation and fluid accumulation around my brain. This is extremely serious. We need to take you to surgery immediately to drain the abscess and remove infected tissue. We're also changing your antibiotic regimen to drugs that penetrate the blood-brain barrier better. I couldn't process it. 10 days ago, I'd had a sensitive tooth. Now I had a brain infection that could kill me. How did this happen? I managed to ask, my voice weak. Dr. Fernandez's expression was a mix of sympathy and anger. Dental infections in the upper jaw can spread through the venous sinuses into the brain. It's rare, but when initial infections aren't treated promptly and aggressively, this is a known complication. You should never have gotten to this point. The implication was clear. Dr. Whitmore's failure to diagnose and treat my infection properly had allowed it to progress to a life-threatening stage. The neurosurgery happened that night. I signed consent forms with shaking hands, terrified I might not wake up. My parents drove 4 hours from their home to be there, arriving just before I was taken to the OR. My mother sobbed, clutching my hand. My father looked like he'd aged 10 years in the hours since they'd gotten the call. "You're going to be fine," my mother kept saying, more to convince herself than me. "You're strong, you're healthy, you're going to be fine." I wanted to believe her. The surgery took 6 hours. Dr. Fernandez had to create a burr hole in my skull to access and drain the epidural abscess, then remove infected tissue from the meninges. The bacterial meningitis required aggressive treatment with intrathecal antibiotics, delivered directly into my cerebrospinal fluid. When I woke up in the ICU, my head was wrapped in bandages, and I had a central line for medication delivery. The pain was incredible, worse than anything I'd experienced. I was on a morphine drip, but it barely touched the agony in my head. Dr. Fernandez came by the next morning to check on me. She examined my pupils, tested my reflexes, asked me questions to assess my cognitive function. "You're doing as well as can be expected," she said carefully. "The surgery went well. We removed all the infected tissue we could access and placed drains. Your CT from this morning shows the abscess is smaller. But Jordan, you need to understand you're not out of danger yet. Brain infections are unpredictable. We're monitoring you constantly." I spent 2 weeks in the ICU. My parents took turns staying with me, sleeping in uncomfortable chairs, bringing me things from home to make the sterile room feel less terrifying. My colleagues came by during their breaks, shocked and horrified by what had happened to me. Beverly, the nurse who'd first noticed my tooth pain, cried when she saw me. "I told you not to wait," she said, holding my hand. "I'm so sorry." I assured her this wasn't her fault, but we both knew whose fault it was. During one of my more lucid moments, I asked my father to contact a medical malpractice attorney. He hesitated, uncomfortable with the idea of a lawsuit, but I insisted. "Dad, Dr. Whitmore nearly killed me. He dismissed my symptoms, missed an obvious infection, and didn't follow up properly. If I'd waited another day to come to the ER, I might be dead. This wasn't bad luck. This was negligence." My father made the calls. The attorney, a woman named Patricia Donnelly, who specialized in medical malpractice cases, came to the hospital to meet with me. She listened to my story, took detailed notes, and reviewed my medical records with a critical eye. "This is one of the most clear-cut cases of dental malpractice I've seen," she said bluntly. "A patient presents with tooth pain, the symptoms progressively worsen, you report increasing severity multiple times, and the dentist repeatedly dismisses your concerns without proper diagnostic workup. The standard of care requires additional imaging or specialist referral when initial treatment fails." Dr. Whitmore did neither. Patricia explained that dental malpractice cases were actually harder to win than medical malpractice cases because dentists had strong professional liability protection, and patients often waited too long to seek treatment, making causation difficult to prove. "But in your case, you sought treatment immediately and repeatedly. You did everything a reasonable patient should do. And Dr. Whitmore's records show he was aware of your worsening symptoms but chose not to escalate care. That's textbook negligence." She filed the lawsuit within a month, while I was still recovering in the hospital. The legal process moved slowly, but the case was strong. Patricia subpoenaed all of Dr. Whitmore's records, including his notes from my appointments and his emergency line calls. What she found was damning. Dr. Whitmore had documented my first visit as patient reports mild sensitivity, likely gingival recession. No treatment indicated beyond desensitizing toothpaste. But his notes from my second visit, 4 days later when I'd reported swelling and worsening pain, were more revealing. Patient returns with continued discomfort and minor swelling. X-ray still shows no obvious pathology. Patient appears anxious about symptoms. Prescribed antibiotics to ease patient concerns, though clinical presentation does not strongly support infection. He'd prescribed antibiotics not because he believed I had an infection, but to placate what he perceived as my anxiety. That was a devastating admission. His notes from the emergency call at 3:30 a.m. were even worse. Patient called with complaints of spreading swelling and headache after less than 24 hours on antibiotics. Counseled patient that antibiotics require time to work, and that some increase in symptoms is normal during immune response. Patient seems overly focused on symptoms. He documented that he thought I was being a hypochondriac even as a life-threatening infection was spreading toward my brain. Patricia scheduled depositions 6 months after I was discharged from the hospital. By that point, I'd physically recovered enough to return to work, though I still had weekly follow-up appointments with neurosurgery and infectious disease. The epidural abscess had resolved with treatment, and the meningitis had cleared, but I'd been left with permanent consequences. Chronic headaches that flared up unpredictably, slight hearing loss in my right ear from the infection's proximity to my auditory structures, cognitive impacts that were subtle but real, difficulty with short-term memory, occasional trouble finding words, fatigue that hit without warning. Dr. Fernandez had told me these might improve with time, but some could be permanent. At 28 years old, I had lasting brain damage from a dental infection that should have been treated with a simple root canal or extraction if caught early. Instead, Dr. Whitmore's repeated dismissals had allowed the infection to become life-threatening. Dr. Whitmore's deposition was scheduled first. Patricia took me to her office the day before to prepare me. He's going to try to make this seem like a rare complication that couldn't have been predicted. He'll argue that x-rays didn't show infection, that he prescribed antibiotics when you returned with swelling, that he responded appropriately to your emergency calls. Our job is to show that he failed to meet the standard of care at multiple decision points. The deposition itself was held in a conference room at Patricia's law firm. Dr. Whitmore arrived with his attorney, a sharp-dressed man who specialized in defending medical professionals. I sat next to Patricia, across the table from the man who'd nearly killed me through his negligence and arrogance. He wouldn't make eye contact with me. Patricia started with basic questions establishing his credentials, his years of practice, his training. Then she moved to my case. Dr. Whitmore, when Jordan first presented to your office on September 26th with complaints of severe tooth pain, what diagnostic steps did you take? Dr. Whitmore cleared his throat. I performed a visual examination of the affected tooth and took an X-ray. Both showed no obvious signs of decay or infection. Based on these findings, I diagnosed thermal sensitivity. Patricia pulled up the X-ray on her laptop. This is the X-ray from that first visit. Do you still maintain it? Shows no signs of pathology? Dr. Whitmore studied the image for a long moment. The X-ray shows no obvious decay or abscess. There's some widening of the periodontal ligament space, but that can be normal variation. Patricia zoomed in on the area he mentioned. Dr. Jenkins, your expert witness, stated in his report that this widening of the periodontal ligament is actually an early sign of infection and should have prompted further investigation. Do you disagree with Dr. Jenkins's assessment? Dr. Whitmore's attorney objected that Patricia was asking for expert testimony, but Dr. Whitmore answered anyway. In hindsight, perhaps the periodontal ligament space should have raised more concern, but at the time, based on my clinical experience, I felt it was within normal limits. Patricia moved to the next appointment. When Jordan returned 4 days later with increased pain, visible swelling, and reported worsening symptoms, you prescribed antibiotics. Your notes indicate you prescribed them to ease patient concerns, rather than because you believed an infection was present. Can you explain that decision? Dr. Whitmore shifted uncomfortably. I prescribed antibiotics as a precautionary measure. The patient was clearly distressed, and I wanted to rule out the possibility of an infection, even though I didn't see strong clinical evidence for one. Patricia's voice sharpened. So you prescribed antibiotics without believing they were medically necessary? That's contrary to standard practice for antibiotic stewardship, isn't it? Dr. Whitmore's attorney objected again, but the damage was done. Patricia continued, walking through each interaction. The emergency calls, his dismissal of my worsening symptoms, his failure to order additional imaging or refer me to a specialist when the antibiotics didn't work. With each question, Dr. Whitmore's decisions looked worse. Patricia then played her trump card. She pulled up records from Dr. Whitmore's practice showing 3 other patients in the past 2 years who'd filed complaints with the state dental board about missed infections. One had required hospitalization for a severe abscess. Another had lost a tooth that could have been saved with earlier intervention. The third had developed osteomyelitis, a bone infection, that required months of IV antibiotics. Dr. Whitmore, you have a pattern of dismissing patient reports of worsening dental pain. Would you say you tend to minimize patient symptoms? His attorney tried to object, but Dr. Whitmore's face had gone pale. He'd clearly not known that Patricia had found those other cases. I don't believe I minimize symptoms. Each case is different, and I make clinical judgments based on the information available at the time. Patricia leaned forward. The information available to you included Jordan's repeated reports of worsening pain, visible swelling, fever, and spreading facial symptoms. You dismissed all of those as anxiety and normal progression. A patient ended up with bacterial meningitis and a brain abscess. At what point would patient symptoms have concerned you enough to escalate care? Dr. Whitmore had no good answer. The deposition lasted 4 hours, and by the end, his attorney looked as defeated as he did. My own deposition was scheduled for the following week. Dr. Whitmore's attorney tried to make me seem like an unreliable historian, suggesting I'd downplayed my symptoms during my appointments and then exaggerated them in retrospect. But Patricia had prepared me well. I'd kept text messages I'd sent to friends describing my pain. I had my work schedule showing I'd called in sick, which I never did. I had my pharmacy records showing how much pain medication I'd purchased in that 10-day period, far more than someone with simple sensitivity would need. Most importantly, I had my medical records from the hospital showing the severity of the infection and the extent of the surgery required to save my life. The attorney tried one more angle. Isn't it true, Ms. Jordan, that dental infections can progress rapidly and unpredictably? That even with proper care, sometimes patients develop complications? I looked directly at him. Yes, infections can progress rapidly. That's exactly why Dr. Whitmore should have taken my worsening symptoms seriously and escalated care. If he'd extracted the tooth or referred me to an endodontist during my second visit, when I had visible swelling, the infection would never have spread to my brain. Instead, he told me I was anxious and sent me home. The case never went to trial. 2 months after depositions, Dr. Whitmore's insurance company offered a settlement of $2.8 million. Patricia advised me that it was a strong offer, likely close to what a jury would award, and accepting it would spare me the stress and uncertainty of a trial. I agreed to settle. Part of the settlement included Dr. Whitmore's agreement to report the case to the state dental board and complete continuing education on infection recognition and patient communication. He also agreed not to contest any board discipline that might result from their investigation. The dental board's investigation took another 6 months. They reviewed not just my case, but the 3 previous complaints Patricia had uncovered. plus 2 more that came forward after news of my lawsuit became public. The pattern was undeniable. Dr. Whitmore routinely dismissed patient symptoms, particularly in younger patients, assuming complaints were exaggerated or anxiety-driven. In 4 cases over 3 years, patients had developed serious complications from infections he'd missed or minimized. The board suspended his license for 2 years and required him to complete a comprehensive remedial training program before he could apply for reinstatement. Effectively, his career was over. At 65 years old, 2 years away from retirement age, he'd likely never practice dentistry again. I felt no satisfaction in his downfall, only exhaustion and lingering anger. I'd nearly died because a professional I trusted had been too arrogant to listen when I told him something was wrong. The settlement money would cover my ongoing medical expenses and compensate for my lost earning potential, since I'd had to cut back to part-time work due to my cognitive issues and chronic fatigue. But no amount of money could give me back my health or undo the trauma of nearly dying from a treatable infection. The hospital where I worked used my case in their Grand Rounds education series. Dr. Fernandez presented my case to the medical staff as an example of how dental infections can progress to life-threatening complications and the importance of taking patient reports of worsening symptoms seriously. The presentation was humbling and horrifying, seeing the CT and MRI images of my brain infection projected on a large screen, hearing the gasps from the audience when Dr. Fernandez described how close I'd come to death. Beverly came to the presentation and cried through the whole thing. Afterward, several physicians came up to tell me they were changing how they approached dental complaints in the ER, being more aggressive about imaging and specialist referrals. My case had literally changed practice patterns at a major hospital. A year after my surgery, I got a letter from a woman named Christine Volkov, who'd been a patient of Dr. Whitmore's. She'd seen the news coverage of my lawsuit and wanted to share her story. She'd gone to Dr. Whitmore 5 years earlier with tooth pain and been told it was sensitivity. She'd trusted him, but the pain got worse. Unlike me, she hadn't pushed back or sought a second opinion. By the time she finally went to a different dentist, the infection had destroyed so much bone in her jaw that she'd needed reconstructive surgery and dental implants. She'd lived with chronic pain for years. She'd thought it was her fault for not being more assertive, for not demanding better care. Reading about my case had shown her it wasn't her fault at all. She'd filed a complaint with the dental board, adding to the evidence against Dr. Whitmore. Her letter ended with, "Thank you for holding him accountable." I thought I was alone. I thought I was weak for not speaking up. Now I know he was the problem, not us. I wrote back, and we became friends, bonding over our shared experience of medical dismissal and the long recovery from infections that should have been caught early. She encouraged me to share my story more publicly, to help other patients understand that they had the right to question their providers and seek second opinions when something felt wrong. 2 years after my infection, I was invited to speak at a dental school about patient advocacy and the importance of listening to patient symptoms. It was terrifying, standing in front of a lecture hall full of dental students, but I told my story honestly. I showed them the timeline of my symptoms, the x-rays Dr. Whitmore had called normal, the CT and MRI images showing the infection that had spread to my brain. I described the pain, the fear, the dismissal I'd felt when a professional I trusted told me I was overreacting. "You're going to have patients who seem anxious," I told them. "You're going to have patients who come in frequently with complaints that seem minor. But I need you to understand that patients know their own bodies. When someone tells you their symptoms are worsening, believe them. Do the extra test. Make the referral. Take the extra 5 minutes to really examine them. Because the alternative is what happened to me, or worse." The students were silent, many taking notes. One young woman raised her hand and asked, "How do we balance listening to patients with not overtreating? We're taught about antibiotic resistance and not doing unnecessary procedures." I appreciated the question. That's a valid concern, but there's a difference between unnecessary treatment and appropriate escalation of care when initial treatment fails. If a patient returns with worsening symptoms after you've prescribed conservative treatment, that's not the time to continue being conservative. That's when you do the additional imaging, the specialist referral, the more aggressive intervention. Trust, but verify. And when your initial assessment might be wrong, be humble enough to reconsider. The speaking engagement led to more invitations. I spoke at nursing conferences about patient advocacy, at medical schools about complications of dental infections, at patient safety seminars about the importance of listening to patient concerns. My case became a teaching tool, used to illustrate multiple concepts: diagnostic error, the dangers of premature closure, the importance of clinical follow-up, the need for humility in medical practice. Dr. Whitmore's name was usually omitted from these presentations, but everyone in the dental community knew who the case was about. His downfall had been quiet, but complete. 3 years after my infection, I was finally able to return to full-time work. The chronic headaches had diminished with time, though I still got them occasionally. My memory issues had improved with cognitive therapy, though I still had to use more reminder systems than before. The hearing loss was permanent but manageable with a hearing aid. I'd learned to live with the changes, to accept that I'd never be exactly who I was before the infection, but that I could still have a meaningful career in life. I transferred to a different hospital, wanting a fresh start somewhere I hadn't been a patient. I specialized in surgical nursing, finding purpose in helping other patients through their medical crises. I was hypervigilant about potential infections, maybe overly so, but I'd rather err on the side of caution. I knew what could happen when infections were dismissed or missed. I still got triggered sometimes. A certain antiseptic smell that reminded me of the ICU, the sound of an MRI machine, articles about brain infections. I'd developed PTSD from the experience, something I'd only realized when I had a full panic attack during a routine dental cleaning at my new dentist's office. I'd started therapy for it, working through the trauma of nearly dying and the violation of trust I'd experienced. My therapist helped me understand that what happened wasn't just about a medical error. It was about a power dynamic where a professional I'd trusted had dismissed my legitimate concerns, making me doubt my own perceptions and instincts. That kind of dismissal, especially from a medical authority, created lasting psychological wounds beyond the physical damage. The settlement money I'd received allowed me to do something meaningful. I established a foundation to provide financial assistance to patients who'd experienced medical or dental malpractice, but couldn't afford to pursue legal action. Medical malpractice cases were expensive to prosecute, requiring expert witnesses and extensive documentation. Many patients with legitimate claims never got justice because they couldn't afford the upfront costs. My foundation changed that, funding cases that had merit but lacked financial backing. We'd helped 12 patients in the first 2 years, including 2 dental malpractice cases involving missed infections. 4 years after my infection, I got a call from Patricia Donnelly. Dr. Whitmore was petitioning the dental board for reinstatement of his license. He'd completed his suspension and his remedial training. He was arguing that he'd learned from his mistakes and should be allowed to practice again under probationary supervision. The board was holding a hearing, and they'd invited me to provide testimony about the impact his negligence had on my life. I agonized over whether to participate. Part of me wanted to move on, to stop defining myself by what he'd done to me. But another part knew that if I didn't speak, he might go back to practicing and potentially harm other patients. I decided to testify. The hearing was held in a bland government conference room. Dr. Whitmore sat with his attorney, looking older and more tired than I remembered. I took the witness stand and told the board everything: the physical impact, the cognitive changes, the chronic pain, the PTSD, the career disruption. I told them about Christine and the other patients who'd suffered because of his pattern of dismissive care. Dr. Whitmore has had 4 years to reflect on what he did wrong, I concluded. But in his petition for reinstatement, he describes my case as an unfortunate complication and a rare outcome that couldn't have been predicted. He still doesn't understand that this wasn't a complication. It was negligence. Until he takes full responsibility for his failures and demonstrates genuine understanding of how his actions nearly killed me, he shouldn't be trusted with patients. The board deliberated for 3 hours. When they returned, the chair read their decision. After careful consideration of Dr. Whitmore's petition and the testimony provided, we have decided to deny reinstatement of his dental license. While Dr. Whitmore has completed the required remedial training, his petition demonstrates a continued lack of insight into the severity of his clinical failures. His characterization of Ms. Jordan's case as an unforeseeable complication rather than a failure of clinical judgment shows he has not internalized the lessons he was meant to learn. Furthermore, the testimony from multiple former patients reveals a pattern of dismissive care that goes beyond a single error. Dr. Whitmore may reapply for license reinstatement in 2 years, but any future petition must demonstrate genuine acceptance of responsibility and comprehensive understanding of how his practice patterns failed patients. Dr. Whitmore's face crumbled. His attorney immediately began discussing appeal options, but it was over. He'd never practiced dentistry again. I walked out of that hearing feeling something I hadn't felt in 4 years. Closure, not happiness, not vindication, just a sense that the system had worked, that justice had been served, that other patients would be protected from the same dismissive arrogance that had nearly killed me. 5 years after that Wednesday morning when I'd first felt pain eating cereal, I stood in front of another dental school lecture hall. This time, Dr. Fernandez was with me, presenting our case together as an example of how dental and medical professionals must collaborate to prevent catastrophic complications. We showed the x-rays, the CT scans, the MRI images. We walked through the timeline, identifying the decision points where different choices could have changed the outcome. Medical education teaches us to trust our clinical judgment, Dr. Fernandez told the students, but it must also teach us to question our assumptions and to listen when patients tell us something is wrong. Ms. Jordan did everything right. She sought care promptly. She reported worsening symptoms. She advocated for herself repeatedly. She was failed by a system that valued efficiency over thoroughness and by a provider who valued his own judgment over his patient's experience. I added my perspective. You're going to make mistakes in your careers. Every medical professional does. But the difference between an error and negligence is what you do when evidence challenges your initial assessment. When a patient returns with worsening symptoms, that's evidence. When a patient tells you something feels wrong, that's data. Use it. Adjust your thinking. Be humble enough to say, I might have missed something. Because the cost of being wrong isn't just embarrassment or a malpractice lawsuit. It's someone's life, someone's brain, someone's future. The students gave us a standing ovation, and afterward, several came up to thank us and to promise they'd remember our story when they were practicing. One young man, close to tears, said his sister had died from a dental infection that had spread to her heart. The dentist kept telling her it was nothing, he said. She was only 24. If someone had listened to her the way you needed someone to listen to you, she might still be alive. Thank you for making sure these students understand what's at stake. That conversation stayed with me for days, a reminder that my case wasn't unique, that medical dismissal happened constantly, that patients were dying or suffering permanent harm because providers weren't listening. It reinforced my commitment to speaking out, to sharing my story, to demanding better from the medical system. I'd survived, but others hadn't. I owed it to them to keep fighting for change. The chronic headaches still came. The hearing loss was permanent. The cognitive changes had plateaued, but not fully resolved. I still had nightmares sometimes about waking up paralyzed while my heart stopped, about being conscious but unable to move while infection consumed my brain. But I'd built a life beyond the trauma. I'd found purpose in advocacy and education. I'd connected with other survivors and helped them find their voices. I'd forced a negligent provider out of practice and changed how a major hospital approached dental complaints. My infection had nearly killed me, but surviving it had given me a mission. And in a strange way, that made the suffering mean something. Not worth it, never worth it, but meaningful nonetheless. 6 years later, on a Wednesday morning in late September, I stood in my kitchen eating cereal. The date wasn't lost on me, the anniversary of when everything had started. My phone buzzed with a message from Christine, who'd become one of my closest friends. Thinking of you today. You're a survivor and a warrior. Love you. I smiled and texted back, then finished my breakfast without incident. The tooth that had been extracted was long gone, replaced with an implant that functioned perfectly. The other teeth were healthy, carefully monitored by my new dentist who was almost comically thorough in her examinations. My brain had healed as much as it was going to. I'd adapted to the changes, built workarounds for the deficits, made peace with the scars both visible and invisible. I'd survived something that should have killed me, and I'd made damn sure that my survival had purpose. That was enough. That had to be enough. That was everything. Thanks for watching till the end. Make sure to subscribe and like to not miss the next story.